Thank
San
you so
Francisco.
much. So I will talk about San Francisco's Getting to Zero effort, which is to get to zero new infections, zero HIV-associated deaths, and zero stigma and discrimination. So we've formed this consortium, which is this multi-sector group that's come together, aligned our agendas to all work towards that common goal. It involves activists, academicians, providers, community-based organizations, the health department, our political leaders, and a variety of other interested individuals and private industry and foundations, all to get towards this common goal. We have sort of four central strategic priorities. The first is to improve health for persons at risk for or living with HIV in San Francisco, and our emphasis needs to be on underserved populations, which we'll talk about in a moment, to create innovative programs and demonstrate impact with measurable objectives, and that's really critical to what it is that we're doing. We are basing our decisions on the data, and we are committed to reporting back on the data and how we're doing to hold ourselves accountable to really getting to those goals of zero new infections and zero HIV-associated deaths. While our health department has provided a lot of support and our mayor has provided funding for what it is that we're doing, we're really committed to securing multi-sector funding and support for existing and new programs. So the idea here is to build upon what we already have, to make sure that we work on what we have. We don't abandon that. We take the things that are successful and then build upon those, and then also to work with other cities to exchange best practices. So our work is done in committees by volunteers. So this is a totally a volunteer effort, and I really want to thank all of the people who have put countless hours into this effort. We decided to start with 4 initiatives. There's a PrEP initiative to scale up PrEP access and knowledge and use, rapid linkage to care upon diagnosis, retention and re-engagement in care, and then an ending stigma group. So we have these 4 separate committees, each of which has their own goals, and stigma works, the ending stigma works through all of the other committees. And feeding into these committees is the entire consortium, and I've described a little bit of the makeup of that group. So I'm going to tell you about some of the major foci of each of these committees and then where we are in terms of the data. So the PrEP committee had sort of the most to do to begin with because they had to take what didn't exist in terms of infrastructure and build infrastructure for providers to increase capacity to provide PrEP, for potential PrEP users to ensure that there was knowledge and access to PrEP, and then to measure the impact of PrEP. So the provider group came up with a common protocol. They've launched a number of provider and clinic staff trainings throughout the city, private providers as well as clinics, and developed a number of new PrEP-specific clinics. The potential PrEP user group has funded or has really launched a number of navigators, because one of the key barriers for people accessing PrEP is not knowing whether or not they can pay for it, what insurance will cover, and who their provider even is. And so we've got these navigators. We've launched some social media campaigns, and then PrEP ambassadors who are PrEP users who can speak one-on-one with other individuals at health fairs and in a variety of different settings to talk about their experiences with PrEP to demystify it. And then we're harmonizing our data sources and developing data from Sentinel sites so that we can actually measure the impact of PrEP on HIV incidence. So this is just some of the preliminary data. The red bars are from our municipal sexually transmitted disease clinic, and you can see that after 2012, we had a massive increase in the number of people who had heard of PrEP. This is among, predominantly among men who have sex with men. The NHBS is a population-based survey, and that also was very high in 2014. And then the Stop AIDS group does street outreach, and we had 90% who had heard of PrEP. So PrEP knowledge went way up, as did PrEP use. And these come from those same, these same surveys. And in 2015, 20 to 25% of men who have sex with men in San Francisco reported that they had taken PrEP. The RAPID initiative is an initiative to try to link people immediately upon diagnosis to services, wraparound services, as well as to initiate antiretroviral therapy same day if possible. And so this group has launched navigators at a variety of San Francisco clinics. There's a clinical protocol that's been developed that has been sent out into the community. We've got people going out and training individual providers, as well as sharing it with other jurisdictions. And then we're measuring, again, the impact of RAPID on linkage to care. And so you can see the mean number of days from diagnosis to care initiation from 2013 to 2015 has dropped from 45 to 20. Care to the initiation of care to starting antiretroviral therapy has dropped. The mean has dropped to 15 days. And then the diagnosis to viral suppression has dropped from 211 days down to 87 days. So we're on our way towards getting people into care immediately. And then the Retention and Reengagement Committee has had its work cut out for it. It's very difficult to re-engage and retain people in care, especially when they have other major issues going on in their lives. So we've set up retention navigators at the major clinics to do outreach to help re-engage people in care and keep them in care. We've got a frontline workers group that does capacity building among the frontline workers as well as support for them. And then a data to care initiative where we're specifically going after people who have recently dropped out of care before we lose them to follow up, to go and do outreach to them to try to re-engage them in care. These are some trends in linkage and retention in care from 2010 to 2013. So this predates the getting to zero effort. But what you can see is this looks pretty flatline. We've not made much progress prior to these efforts in retention and care. And so it's clear that we need to do more than what we've been doing. So if we take a step back and say, well, how have we been doing? Where are we going? You can see that the number of new infections has dropped from 519 in 2006 to 302 in 2014. So we've had a decrease in the number of new diagnoses. We've had a decrease in the number of deaths, and of course then an increase in the number of people living with HIV. So it does look like these trends, these lines, are heading down towards zero, and that perhaps we could just float our way onto zero. But what's really clear is that there is a group of people that we've not yet reached that is going to take additional effort, and that we're not going to get to zero if we just continue to float downward, that we need additional efforts. Because this is also San Francisco. So we often show the picture of the Golden Gate Bridge, beautiful Victorian homes, but this is the reality of San Francisco as well. And we need to address issues of housing, mental health, and substance use. If we don't address those issues, we will not get to zero. And we have a real issue with homelessness, substance use, and mental health issues in the city. So one of the things that we have to focus on is the blue bars here. I don't know how well the colors project, but the ones on the left are the demographics, race, ethnicity, and age of those who have been newly diagnosed. Those are the groups that we need to reach out to with PrEP so that we can stop them from becoming infected. The ones on the right-hand side are those living with HIV. So that's the group that we need to be sure that we're engaging and retaining in care. So we need PrEP for a diverse, somewhat younger population, but 58% of the people living with HIV in San Francisco are over the age of 50. So we really need services for an older population as well in terms of retention. One of the questions that comes up is, gee, maybe your numbers are getting better because you've got the cost of living has gone up and a lot of people are leaving the city. And each year, about 7.5% of the population in San Francisco moves out, and another 7.5% move in. And what you can see is that the people who are moving in generally have more resources available to them because they need them in order to be able to afford housing in the city. And we're losing younger populations and a more diverse population that's moving out. So these numbers in this table just show the annual change, and the numbers in red are the people who we're losing, and the black is the number of people who we're increasing. This is a really critical issue for both PrEP and for retention and care. So we can't retain people on PrEP and we can't retain people in care once they leave. We don't have the same kind of access to them. And so what's really critical, it's difficult for our measurement, but it's also really difficult for our getting to zero if we lose people moving out of San Francisco who we've not been able to retain in PrEP or care. So in conclusion, San Francisco's made some great steps towards PrEP knowledge, uptake, and capacity, as well as rapid initiation of treatment and services. But we need to focus specifically on health inequities that are fueled by homelessness, poor mental health, substance use, and poverty, because these are what are driving both new infections as well as inadequate care. And the in and out migration that we see makes tracking and sustaining the impact challenging. So what we're really trying to do is to focus on uptake and retention of PrEP, particularly for younger people where we're seeing our new diagnoses. And retention has to account for an aging population living with HIV. And I want to just refer you to our website, gettingtozerosf.org, where you can get more information. And thanks to the more than 200 members who volunteer their time and effort, and the variety of organizations who support us. And this is a list of our steering committee. So thank you very much.